So this is a very interesting data as we have a very limited option for first line progression, and the second line is not that effective, but it looks to be promising in phase 2, and let's see what's the result of phase 2. And the phase 3 study is already being planned. So this is the primary analysis from the phase 2 study of continuous talazoparib, which is a PARP inhibitor plus intermittent low dose temozolomide in patients with relapsed or refractory extensive cell small cell lung carcinoma. So there is some basic background why the combination of a talazoparib with the temozolomide is effective. So if you see the lower graph, this is the mouse xenograft model where they combine the talazoparib alone. The blue one is the temozolomide alone, and the yellow one is the talazoparib with temozolomide. And it is the shrinkage of the tumor. If you see the this chart, the maximum shrinkage is seen in the combination of a talazoparib plus temozolomide. So mouse xenograft or ovarian cell line of RMG were treated with talazoparib, temozolomide or combination. The combination of the temozolomide, talazoparib, that is this yellow graph, was more effective in suppressing xenograft growth than the either single agent. So there was some scientific reason for combination, and with this basic data, this trial come up. So the primary objective of this combination therapy was to assess the overall response rate versus a historical control rate of 15% ORR with second line of a this topotecan based study. So the null hypothesis was that will be rejected if 8 or more confirmed response among 28 available patients, that is 29% of overall response rate. So if 8 or more patient out of a 28 will respond, then this null hypothesis will be rejected, and then this will be proceeded to a full phase 3 study. The key secondary endpoint were the standard, the progression-free survival, overall survival, and duration of response. And exploratory endpoint include biomarker analysis and patient-reported outcome. So this is a study of a talazoparib plus temozolomide in extensive stage SCLC, relapsed or refractory to a first-line platinum. So they included both some patients who have even a platinum-sensitive relapse, still they were taken in this study. And the dose they were used, talazoparib was 0.7 mg. Since this drug has a known creatinine clearance effect, the drug gets affected with the creatinine clearance. So those patients who have less than 60, 0.5 mg was used on a continuous 28 cycle, while the dose of the, if you see the, look towards the dose of the temozolomide was 37.5 mg per meter square, which is quite less compared with the, what we do in a standard temozolomide in GBM cases. So 37.5 mg per meter square for day 1 to day 5, and the talazo continue at the 0.75. 15 patients were enrolled in the first stage, and then the stage 2 will begin if 3 or more patients have some response, and the response were assessed as per the RECIST 1.1 criteria. So out of 28 patients, there are the overall response, one patient defaulted. So this is one of the CT scan of those one of the patients. So this is the baseline scan, and this is the response scan. There is a clear-cut, definite improvement in the tumor shrinkage in both these cases. When they look towards the data of all these patients, so 1, 4, these are the, so this group is of the patient who have a partial response. Second group is the patients who have a stable disease as a best response. So this is the best response, and is there any association with the DDR or HRR mutation? So those patients, so those patient number 1, patient number 6, 14, so these are the number of the patient, and the DDR gene which they tested are ATM, BRCA1, BRCA2. So if you see this patients who have and this is the progressive group, patient who have progressed. So indirectly, what we can say that those patients who have some or other BRCA or DDR related mutation, the probability of response, so they have not taken the patient as per the DDR. All patients, irrespective of the mutation, whether there is a somatic mutation that is the present at the time of starting of therapy. So it looks like that those patients have some sort of a mutation either at baseline or at treatment emergent. They respond somewhat better, because if you see the progressive, only one have this yellow, that means the baseline. So some or other relation with the DDR mutation, though they have not included the patient, and next study they are looking towards whether those who have a DDR mutation may respond still better. This is the waterfall plot, and if you see majority of the patients, if you see the maximum response from the baseline, majority of the patient, except these 3 or 4, these all have responded, and some have a more than 40 to 50% reduction as a best response. So if you see the number of patients who have responded compared to the patient who have a progressive disease, this number is very less, and that means the response was seen in. Similarly, the swimmer plot also confirmed the same finding, that combination therapy responded well. So the study exceeded its target response rate. So the response rate which was expected in this, what they initially thought, that around 3 out of 8, if 3 respond, they will go to the second phase. That is part study completed, and then the second out of 28, 11 patients responded. So this study exceeded its target response rate, and this is the second trial to demonstrate a benefit of PARP inhibitor with low dose temolizumab in SLC. So on this data, a phase 3 study is appropriate to confirm benefit of this approach compared to the currently approved option. So already a phase 3 study is being planned for this, and in day-to-day setting, in some patients with this data, although it's still a very early, but in patients who have a very progressive disease, limited option, and if you have a by chance a response, they can be considered. And fortunately, the other PARP inhibitor, so those still a time, but can be a case-to-case basis. This can be considered in day-to-day practice. Thank you.